My name is Aisa Tediawara. I'm a technical specialist at Glide, and I will be your host for today. In this episode, we'll highlighting Cabo Verde's success in eliminating malaria, and I'm pleased to be joined today by Dr Adilson de Pina, Head of Malaria Elimination at Cabo Verde Ministry of Health. Adilson, welcome, and thank you for joining us.
Thank you. Thank you so much, Dr. Adilson. For me, it's a big pleasure to be here to share this experience. As you mentioned, I'm Adilson de Pina. I work with malaria elimination program in Cabo Verde since 12 years ago. I'm biologist by background and a specialist in public health monitoring and evaluation, working in the Ministry of the Health. Thank you so much.
So Cabo Verde has made some incredible progress in disease elimination. So in January 2024, the World Health Organization declared Cabo Verde malaria-free, making it the third country in Africa and the 43rd in the world to achieve this status. And this achievement is even more impressive considering the global context. According to the latest World Malaria Report published in 2022, there were an estimated 249 million malaria cases worldwide with 608,000 deaths. So this number highlighting the ongoing challenges many countries face in tackling this disease. Cabo Verde's success didn't happen overnight. And in fact, Cabo Verde has achieved malaria twice in the past. So Adilson, can you please tell us the story about what hindered you in the past? And also tell us what worked this time and how you build on earlier efforts.
Thank you so much again, Dr. Adilson. Talking about the malaria elimination in Cape Verde and this third time, normally we say the third is the time. During the past, the Ministry of the Health had the program, the goal to achieve malaria elimination. For 2 times, as you mentioned it, we achieved the 0 local case. But this certification, this moment was not goal, was not worked with the WHO, especially because all the procedures for certification, the country needed to ask the WHO to start this procedure with the WHO. It was not done in the past. But the other thing that didn't work in the past was the way how the program, how the intervention, how the activity was implemented in the country. In this moment, all the activities, all the intervention were centralized in the Ministry of the Health. It was one of the challenges that we face in this moment. All the implementation, all the follow-up, all the organization was centralized in the Ministry of the Health, that they had this role to visit all the municipalities, to visit all the health structures, to do intervention, to respond to the malaria case. And this time, 2024, after the other vector-borne disease reported in the country, namely dengue in 2010 and Zika 2015, the country established in 2010 the first national strategic plan for malaria-free elimination, and all the evaluation was done in the country with support of WHO to evaluate the country, to evaluate the epidemiology, and also to reinforce and prepare the surveillance service. After 4 years, a new evaluation was done, and with the malaria outbreak that we faced in 2017, a new evaluation was done in the country with the support of WHO. A new strategic plan was elaborated 2024, and after the outbreak in 2017, the country did this evaluation, changed some strategy and intervention, specifically the IRS, the intra-residual spraying in the country, that we changed the moment to do it before the raining, because the other thing in the country is the environmental condition. In fact, we don't have a lot of raining season, is during 3-4 months by year. All the intervention was readapted and reviewed and readapted for elimination step. And after 2018, when we reported the last local case, the country reinforced all the intervention, basically the response to the case, the reactive intervention. Everything was done in the sense of elimination. And the other good thing is that the local case was restricted to two islands, Boa Vista and the capital in Praia, in Santiago Island. It means that also this epidemiological situation was favorable to the country, because being and having the local case in all two municipalities was very easy to control, to put effort together to control and to eliminate malaria in the country. And fortunately, we achieved it. We have 10 islands, 22 municipalities. We have municipality where malaria has been reported for decades. And we still doing testing, preventing malaria in this municipality. It means that our surveillance service worked very well, and having the capacity to detect all the single imported malaria cases that arrive the country, and the policies is test, treat, and follow up. All single cases, even today, local case, imported case, but in the past, local case, and simple or complicated malaria, all the simple cases are tested, and the treatment is in the hospital. It means that our health system has this capacity to treat all malaria cases in the country, and after the treatment, the cases are followed by we do this following for 24 years after the treatment, to warrant and to be sure that the treatment was done and that is good, and that there is no risk to this, basically this imported case, to be reintroduced in the country. So it's a big challenge. The country achieved the elimination, and of course now the main goal is how to maintain this elimination, this certification by WHO, and to work in the question of sustainability to keep the country as malaria-free.
Thank you. That's a fascinating overview, and also a very comprehensive overview of the challenges and successes you faced in previous efforts. So building on those experiences, it's clear that adapting and integrating strategies were crucial to your recent achievements. And this aligns with the global technical strategy for malaria, which emphasizes the importance of integration and multi-sectoral collaboration. So with this in mind, how did the integration of various health services contributed to Cabo Verde's success in eliminating malaria? And could you provide example on how different sectors collaborated in this effort?
Thank you for this question. It's a good question. In fact, as I say, we have 10 islands, 22 municipalities. And in the question of integration, in each municipality, we have a health structures, a health infrastructures that we call health delegation. And the question of integration, all the activities, all the health response we are talking here about the primary care. It means that all the prevention activities are done in this health delegation. This integration was done in the country years ago, and it works very well. In this case, we can talk about vector-borne disease that include malaria and the other dengue, Zika virus, and other vector-borne disease that we face in the country. That all the management is done by this health structure. There's a team that work in vector-borne disease, in vector control, in case management. And the integration at the level of activities implementation, it's done. It means that there's a health delegation, they have the capacity, they are supported by the central level, by the Minister of the Health. I mean, in the question of human resource, in the equipment and the capacities to develop the activities, testing, treating, and follow-up, management of case, everything. But also in the question of today, when we talk in integration, in the country, we developed the health information system where all the information pass through using the new ITs. When we talk about malaria today, the information is collected in the field with tablets, with smartphone, and all this information arrived to the national malaria program in real time. We can take a decision to see what is happening in some municipality. If we face some issue, we can go through the database to see what is happening. And the other thing is the question of human resource. Normally, when in a health structure, we don't have a lot of medicine, a lot of nursing, and this sometimes what we do is the same medicine that take about that is a local point for malaria, but it's the same for HIV, for TB. It means that at a local level are these municipalities who implement all these activities, not specific for malaria or other disease, but it's all integrated in their plan work. And in the question of human resource and in the IT, everything is integrated. They do the work and they report for us through the technology today. All the health structures has internet connection. It means that the integration is well done in the country, and the use of technologies and new IT is very implemented in the country, and it supported us. It facilitates our life in the question of have data to analyze and to take a decision.
Yeah, we understand that integration clearly played a significant role in Cabo Verde's success. And equally important is the involvement of local communities in this effort. So what role did local communities play in Cabo Verde's malaria elimination efforts? And can you share any specific community-based initiatives that were particularly impactful?
Yes, we in Cape Verde we have a healthy system. Of course, as in main of country in Africa and in the world, the decision is up down. It means come from the Ministry of Health to the community. But a good thing in the country is that the community is very active, very participative, and they involve in our activities, especially in this case of malaria. Since 2010, when we started with the Global Fund grant in the country, we had worked with the local organizations. They implemented sensibilization activities in the field. We worked with them and we achieved a good result. And specifically for, as I mentioned before, for these two municipalities, Boa Vista and the Praia, we still having a community organization doing this job around the community, especially in the community where we have a lot of migrant population coming, visiting the endemic countries from the continent. And with the National Institute of Public Health, we created a system alert from the community. In Portuguese, is Guardiãos da Saúde, basically guardians of health. And we have this system at community level, especially in Praia and in Boa Vista, not only for malaria, but we started as a pilot, where if we have any issue at the community level, especially with people traveling between the continent to the country, if we have some, at community level, there is some issue, there is some problem, they can directly communicate, they can report to the health system. They receive this alert and immediately we can activate the health delegation to give a response and to, in this case, to try to identify what is the problem. But of course, the more important challenge is regarding vector-borne disease. We have a lot of activities at community level regarding the environmental management, a BCC campaign that they do, and involving a lot of initiative involving the community, but also inviting the health system to participate with them and to help in the situation that, of course, they don't have capacity. But specifically in Praia and Boa Vista, we have in Praia 3 NAIC boards where they are very active and they are very conscientious about malaria, because in the past they had a malaria case and today they are so happy to be considered as malaria-free. So it's again that this community want to show to the others and to the others community in Cape Verde, but also to the world.
Yeah, empowering community is really essential in these efforts. So building on these success strategies we just discussed, continuous learning and collaboration are essential for sustaining and advancing disease elimination efforts. And you recently participated in a course on disease elimination and eradication in Kigali, delivered by GLIDE in collaboration with the University of Global Health Equity, University of Ghana, Noguchi Memorial Institute for Medical Research, and the Carter Center. And the course aimed to deepen participants' understanding of the core principles and provide skills for developing strategies to eliminate and eradicate infectious diseases. Were there any insight or strategy from the course that you found especially valuable in your work?
Yeah, thank you so much. Of course, the Glide was a very interesting experience, and more than for me, especially, was the opportunity to participate as team, as Cape Verde team, with colleagues from different others department of the health in Cape Verde. We were from 3 institutions. This is amazing because we could be together to learn more about disease elimination. Of course, my experience had been with malaria elimination and the control of other vector-borne disease. But this colleague made from different entities, they was not very not involved in the malaria elimination process like me. And of course, this opportunity was primarily very good for us in the question of team to build this capacity to the country. I think that we need in the country, as I mentioned before, we are a young country and we need to build this capacity for the new generation to lead and to keep the gains and to put effort together to achieve good result. Not only with malaria, we are now working for HIV vertical transmission certification by WHO. We have other diseases that the country has the goal to achieve the elimination. One thing that for me was very special in this course that I take with me is the question of the decision in center person. Sometimes, as I mentioned before, we take in the country, our political system is very up down, but this idea to have the person, to have the population, the community in the center of decision, I think it was a homework for me. And how we will develop it in the country, how we could involve the community, the population, the person in the center of our decision. I think is very interesting decision, very interesting thing that I learned personally. And of course, all the other themes that we work on, the question of monitoring and evaluation, program management, everything that we discussed is a lot of information and capacitation. And I hope that we could continue with this kind of capacitation, but more than capacitation, the networking, to share experience, to lead more, and to have some, to bring new ideas, new tools that can help the country, help Cape Verde, not, as I mentioned before, not all to keep malaria elimination, not all for malaria-free country, but for other disease that we face. And of course, today with climate change, there are new disease, new vector for disease, new challenge that we need to face. And for small countries, for islands country, there's a lot of challenge that the country will face and starting face today, and we don't know what will happen in the future.
Thank you, Adilson, for your feedback and for your insights in general. So I have so many other questions I would love to ask, but unfortunately, we're nearing the end of the episode. So before we wrap up, could you share very quickly a key takeaway for our global audience regarding infectious disease elimination?
What I can say for our audience, sometimes when we think, especially in malaria, this disease, the big disease in the world, we face a lot of challenge, especially in Africa. But what I can say is that malaria elimination is possible. Yes, we can do it. Cape Verde is an example of it. We achieve it. Of course, there is a lot of challenge. We need to adequate our intervention to our local reality. It doesn't mean that what we did in Cape Verde can apply directly to the other reality, to the other countries. No. What I can say is that the experience from Cape Verde could be adapted to the other reality. Is basically to see what we did that worked well and how we can transfer this experience for other countries and the other reality. But the key message is, yes, it's possible. We can achieve malaria elimination in Africa. We can save life in Africa, and we can proportionate better quality of life for our population to save, especially to save the children in Africa. It is possible. We just may need to re-found the good way to achieve it, but it is possible. Thank you so much.
Thank you again, Adilson, for ending on a very positive note, and thanks for joining us today. And thank you to our listener for tuning in to our podcast. And we hope you learned something new today on disease elimination efforts. And for more information about GLIDE, please visit our website at www.glideae.org.